Greetings to all viewers. This is a video trying to explain changes that occur in the pregnancy in the months of 4 to 9 months. I'm Dr. Shobna Mohandas. I practice as a gynecologist in Trishur, and only some of the changes in pregnancy can be explained in this video because pregnancy is a vast topic. First of all, we have to talk about the diet. The first 3 months, the woman is vomiting a lot and she is worried and she loses weight. And then suddenly, when she comes into the fourth month, she is generally okay. But you have to understand that the baby is growing now and will require 200 to 400 calories more. So you have to eat that much more food because the baby is growing and it should not go into growth retardation. And normally around 50 to 60 gram per day is normal protein requirement. Normally, whatever 44, 45 was there in the first trimester, an additional 9.1 is needed in the second, and additional 21 is needed in the third trimester, which is the last 3 months. Second trimester is the middle 3 months. So you have to eat more protein and more energy containing diet. So better, you have to eat more. Generally, one vada contains 200 calories. Two paripu vada contains 182 calories. The banana fritters or parambori contains 290 in 3 or 4. 5 breads will contain 350 calories, same as 4 chapatis. 5 biscuits will contain around 110 calories. A handful of cashew nuts will give you a lot of calories, 105, 184 in fact. And even your banana fritters, that will also give you 105 calories. Basically, whichever way you want to eat it, mix and match your food, whatever is tasty, what suits your mouth, and what doesn't harm your stomach. But add a little more food than what you were eating in your pre-pregnancy days. It would have decreased in the first 3 months, but it is not enough to go back to the pre-pregnancy days. You have to add a little more. That much you have to remember, that you have to eat more, and preferably that should have protein more. Now again, 2 eggs will give you 168 calories for the non-vegetarians. 2 chicken lollipop will give you 186 calories. So you add that with eggs or bananas or 2 apples or whatever way. Your one fish fry will give 146 calories. And Keralites, they like the scolli a lot, tapioca. So 100 gram will give a lot of calories. That is almost full additional calorie can be given by those tapiocas. That will give you 358 calories. Not good for diabetics, but other people, they can eat it to give instant calories. Apples contain average 52. One banana, large one, will contain 132. One small will contain 53. Basically, you have to eat more. I'm not saying you should be counting calories, but I'm just giving you an example to see that you have to eat more during your fourth month onward, little more in your after 6 months, mostly protein containing food, because you need additional 9 gram in second and additional 21 gram in third trimester. So that much more protein you have to take. Mostly the non-vegetarian stuff like chicken curry has 26 grams, fish curry has 19 grams, whereas your rice will have only 2 gram, sambar will have only 7 gram, beans will have 2 gram, eggs will have 15 gram. That's almost as good as 2 eggs, the same as good as fish curry, 19 gram. So all these non-vegetarian foods are very rich in protein and easily digestible proteins. But if you are vegetarian, most of the vegetarian food won't give you that much of protein. So you have to take protein supplements. Otherwise, the baby will have IUGR. Yes, there are stuff like soya beans giving 52 gram, paneer 18 gram, oats 13 gram. Peanut butter is a very tasty dish. It contains 25 grams. Cheese is good. Nuts will give you 26 grams. Dals will give you 24. Legumes will give 24. So all these are good, but they are not easily digestible. So if you are vegetarian, it is best to take a protein supplement in addition. But Please take care to take more proteins in your diet, non-vegetarian or vegetarian or supplements. When you are taking fish, make sure you're not taking those large fishes like, king mackerel or marlin fish or shark, because it contains a lot of mercury that can impair the intellect of the baby, neurological development. It's best to eat the smaller fish which are rich in omega-3 fatty acids. It's good for the brain also. So salmon, sardine, codfish, tuna, mackerel, all these are good for improving the omega-3 fatty acids in the body, and they will give excellent protein for growth of the baby. Now, whatever you want to eat, many women have bloating sensation. They have burping of gas, and they always say, I've got gas. That is because of the hormone progesterone, which is abundant in uterus. It is a protective mechanism so that the baby is not thrown out and the uterus is relaxed. But what happens is this relaxation of the uterus is going to the intestines also, and then there is a lot of gas increasing in the intestine, and that will cause bloating and gaseous sensation, which is very uncomfortable and you won't feel like eating. So, how to go about it? If you have allergy to certain foods, like apple or pear or cherries or all these things, they may make a bloating sensation in some women. So you have to avoid these foods because they contain sorbitol. The peaches and cherries and all those things, they have sorbitol making capacity. It ferments in the intestine, so gas is increased. So if you have a bloating sensation and you try these foods and if they cause problem, stop taking. Also, fermentable oligosaccharide, disaccharide, monosaccharide, and polyols. This is a mnemonic for FODMAP, which is substances which will get fermented and form gas in the stomach. Now, it's not for everybody, but if you are getting gas with it, don't take broccoli, cabbage, cauliflower, or celery. If you have a bloating with apple, peaches, plums, or pears, don't take them because they are sorbitol making. Drinks like sports drinks, even coconut water, and some fruit juices, they ferment in the abdomen and they cause gas. So, if you are allergic to it, don't take it. Wheat, some people can't eat chapatis or wheat in any form. Even corn, some people can't take it. So if they are the foods which normally ferment in the body, but most people can accept it. But if you can't, don't take it. Nuts, beans, lentils, sweeteners, dairy products, basically milk, not the curd or the buttermilk, but the milk is, some people they can't accept. Yoga asanas are there, but if you have aches and pains, you can't do yoga asanas like this. So please do it under the, supervision of a trained yoga trainer. Otherwise, you will cause injuries to your body. But all these asanas are supposed to be decreasing the bloating sensation in the abdomen. If you can do it comfortably, well and good. Heartburn is another problem. That's because as the baby grows, the stomach gets pushed up into the chest, and the sphincter is there between the stomach and the esophagus, the food pipe and the stomach, that is. And this sphincter does not allow the food to go up normally. But because of increased progesterone, this sphincter relaxes. And because of that, and also because the baby pushes the stomach up, all these reasons, the sphincter opens out and some of the acid enters the esophagus or the food pipe, and that causes heartburn. So, to avoid heartburn, eat small meals in many times, don't take large meals at one time, and avoid foods like fried items like finger chips or chaklis or mirchi, or all this hot things which causes acidity. All that has to be avoided. And drink liquids between meals instead of with the meal, because when you eat fluids along with your meal, it will cause a lot of bloating. So, it will decrease the digestive capacity also. So in between meals, you have to take the water, and you have to take lots of it because it's necessary to relieve constipation also. And hydration is very important in the body. But do it in between the meals, not along with the meals. That will also reduce the acidity. After food, please sit upright. Don't eat in the lying down position while watching TV or something like that. Take a small walk or stand up or do something after food, so that the acidity decreases. It doesn't go work upwards. Acid doesn't go up into the esophagus. That will always help. Home remedies like fennel seeds, ginger, cloves, cardamom, they are all been time tested things which can help. And your pudina leaves, they are also good. And buttermilk with little bit of dhania leaves in it, they are also good. So all that gives a cooling sensation to the abdomen, in the stomach, and you don't feel acidic. So you have this cinnamon put, you know, jeera put in the hotels after food. That's a practice that has been followed since ancient times, and it definitely has a lot of calcium also in it. So it's nutritive also to take this jeera. So, or putting a little bit of clove under your tongue or put it in the mouth for a long time, it can reduce acidity. So you try doing all these home remedies, but if all that doesn't work, you can even change your position in the bed by putting some mattress and keeping it lifted up while sleeping so that the acid doesn't go up. If nothing works, go to the doctor. She or he can definitely give antacids, either tablets or liquids or digestive enzymes, which will help the digestion and push the food down much faster. So do not deny yourself of medications if the home remedies do not work. Constipation is another problem again because one, because of progesterone, two, because of iron tablets. And it, even anxiety about the pregnancy can cause constipation, lack of exercise, lack of fiber. All this can cause constipation. And the remedy, one is to take lot of water, and hot water is even better. Or fiber rich vegetables like potato, sweet potato, broccoli, okra, carrots, spinach, and even moringa leaves, drumstick leaves, and fruits like grapes are good, whether it is dry or whether it is fresh. All that is good to relieve constipation. Avoid junk foods, avoid oily foods, avoid chocolates. All that is not good for constipation. Sleeping in bed, generally on one side you have to sleep. Especially in the last 3 months, you have to sleep on the left side. Till then, any side you can sleep after 3 months. That will reduce the pressure on the blood vessels on the coming and the back and reduce edema and help the fetal growth. Swelling in the legs is very common. I ask my patients to drink barley water and it helps a lot of them. Put your feet up while sleeping. Put your feet straightened while sitting. Avoid standing for long. Reduce salt intake. Increase potassium intake. All that will reduce the swelling. We can't include all the symptoms in pregnancy, but I've tried to include as many as possible. I hope it will be useful in your pregnancy and hope you have a breezy pregnancy. Thank you so